everyone. My name is Angela Landon, and I am an independent insurance broker. And today, what I'd like to do is walk through the difference between having a Medicare supplement plan and having a Medicare Advantage plan. I'd like to go through the pros and cons of each of those. And my goal is by the end of this video, you will have a thorough understanding of what each of those types of additional coverage you can obtain and which one may be best fit for you or have a little bit better of an idea. Just as a reminder, especially if you just turned 65 or if you're about to turn 65, I do have a video that explains Part A's and B, Parts A and B. However, just as a quick refresher, Original Medicare consists of A and B. A is your hospital coverage and B is your medical coverage. So when it comes to Original Medicare, that is what you are receiving. One thing to note, you cannot have a Medicare Advantage plan and a Medicare Supplement plan at the same time. You can only have one or the other. Well, first, let's go over a Medicare Supplement plan. So when you have Original Medicare, which is A and B, typically, Medicare is going to cover about 80% of your medical costs. You also have some out-of-pocket costs like deductibles. So if you do get hospitalized, there's a deductible that has to be paid before they kick in to pay the hospital coverage. For 2025, it's $1,632, I believe. So it's just over $1,600. That's what you will automatically have to pay up front, whether you're hospitalized for 1 day or 7 days. That's how much it is before Medicare will kick in. That's if you have Original Medicare and nothing on top of that. And then when it comes to your medical coverage and your procedures and such, typically Medicare is going to cover about 80%. So that means you would be responsible for 20%. So that's not a dollar sign as far as a specific copay. That is 20% of whatever the cost is that's being charged for that procedure or that visit. So that's Original Medicare. Now, when it comes to a supplement plan, what a supplement plan does, it's also considered Medigap coverage. And so a supplement plan is going to fill in that gap. So basically, it's going to cover that hospital deductible. It will cover the 20% copay, and I'll go into the different kind of supplement plans and how much each of those would cover. It just depends on what you choose. But the idea is it's going to fill in some of that gap. It can be some of that gap or most of that gap for you. So the benefit of a supplement plan is you have a predictable cost. So with the supplement plan, you do have a monthly premium. You're going to know up front how much the supplement plan is going to cover. And so you're really going to know how much you're going to be responsible for, no matter what kind of medical treatment you have, or doctor's visits, hospitalizations, whatever it is. So you have predictable cost. The other thing, it is predictable cost, but as a con, it has higher premiums. So with a supplement plan, you are going to have a monthly premium. So a monthly premium is something that you have to pay monthly, whether you use that or not. So you'll have to pay extra, and it does depend on what kind of plan you get as to how much that would be. But you will be paying a monthly extra fee. This is on top of what you're paying for Medicare Part B. So Medicare Part B, typically, if you are taking Social Security, that's coming out of your Social Security already, or you could be receiving a bill and you're paying that either monthly or quarterly. So in addition to that, the supplement is an additional premium. It is an insurance company, so you would have a card that has whatever the insurance company name is. And I think this is why some people get confused, because some of the same companies offer Advantage plans and supplement plans. And so sometimes there's confusion into what each of those are. But so it will be an insurance company. You do still have original Medicare. So when you have a supplement plan, you have original Medicare and a supplement on top of that to fill in those gaps. And then the other thing about a supplement plan, you have nationwide coverage. So this is really beneficial if you happen to be, say, somebody that likes to travel a lot, or maybe you have family that lives in another state and you spend a lot of time there. Or if maybe you have an RV and you like to spend several months in different states all over the place, you still have access to coverage. You don't have to worry about any kind of network. As long as the doctor accepts Medicare, then they're going to accept, typically, they will accept your supplement plan. The way supplements work, as long as it's a Medicare covered treatment, so it has to be medically necessary and it has to be covered by Medicare. As long as Medicare is covering it, then the supplement will cover it. If it's a procedure that Medicare doesn't cover, you cannot expect the supplement to pay. So it has to be something that Medicare is going to cover, and then the supplement will fill in a portion or all of that gap, depending on what you choose. So it's really great for flexibility. It's great if you don't, maybe you have certain specialists you want to see and you don't want to worry about a network. You don't have any networks. You don't have to worry about making sure that your primary care doctor is connected to the specialist, and that you're receiving approvals and prior authorizations through a medical group. You don't have to worry about that with a supplement plan. You pick your primary care doctor, you go and see them. They may give you a referral to a specialist, but you don't have to wait for that to be approved by anybody. You just take your referral and go see the specialist. So that is a supplement plan. Now, here is a chart of the different supplement plans. Not all supplement plans are available in all areas or by all carriers, but this gives you the range of the supplement plan. I'd like you to look at column that says G. So G as in good or great. So G is currently the plan that's going to cover the most if you turned 65. Basically, if you turned 65 after 2020, then G is the only plan that is the highest plan that's available to you. Now, if you happen to turn 65 before 2020, then Plan F is available to you. And even if we're not in 2020 now, we're in 2025, even if you turned 65 prior to 2020 and you don't have a supplement now, maybe you're healthy and you'd like to see if you can get a supplement, Plan F would be available to you. So the difference between those, Plan F is the highest one you can get if you turn 65 prior to 2020, and Plan G is the plan you can get if you turn 65 after 2020 or now. So it's basically going to cover everything. G will cover everything except for your Part B deductible. So in 2025, the Part B deductible is $257. So you will be responsible for that amount, but outside of that, the plan is going to cover, the supplement will cover everything. As long as Medicare is covering it, that 20% that is your responsibility, or if you're hospitalized, they will cover that deductible. That gets covered by the plan, 100%. One example I like to share is I used to work for a pharmaceutical company that manufactured biologic pharmaceuticals for very serious conditions, and they were very expensive. Some of the medications could be $40,000 a treatment. And so I worked in the department that handled the insurance, and I saw a lot of times people who had a supplement plan, if they had that plan, Plan F or Plan G, it covered that $40,000 treatment. So $40,000 treatment, if you are responsible for 20%, with original Medicare on its own, that could be unaffordable. So with a supplement plan, a Plan G, that $40,000 treatment, the 20% that you would be responsible for, they cover the whole thing. So that's the benefit of a Plan G. They cover the gaps. You do have to pay the first deductible for your medical coverage, Part B. So that's $257. But outside of that, they're going to cover the rest. Now, there are, so I will let you know, so for Plan F, that plan, they cover the deductible too. And they typically are at a much higher premium rate as well. So, but they'll cover the deductible and then they cover everything. Now, when it comes to, there are other plans. So there's, like K, for example, you'll see where most of the coverage is going to be at 50%. And then there's L, which is 75% coverage. So that's going to be 50% or 75% of the 20% that you're responsible for. So it's not of the whole thing, it's of your responsibility. The other plan that some people tend to like is N. N as in Nancy. So that also covers similarly to a G, except there is a copay. There's also something called a high deductible. So you would have to pay a high deductible prior to it kicking in. So there's a high deductible Plan G, and there's a high deductible F. So it would be where you'd have to pay, I don't know the exact amount off the top of my head. So once you hit that deductible, then the plan covers at 100%. So that's something that will bring down your monthly premium, and it's something that, you can consider in case, you have something that is very expensive and you want to make sure you have that backup plan, and you know that you can hit that deductible if needed. So with a Plan K and Plan L, they cover a different amount. So they're covering 50% of your 20% or 75% of your 20%, and that is up to a certain amount. So for 2025 with a K, the out-of-pocket limit is $7,220. And for L, it's $3,610. So what that means is once you hit that limit, then the plan will cover the rest at 100%. So you're paying, for example, with an L, you're going to be paying 75% of your 20%. And then once you reach 3,610, that's when the plan will kick in at 100%. So that gives you an idea of the different supplement plans, and there are a variety of different insurance companies that offer supplement plans, and they don't all offer every letter, and they aren't all available in every area. So even though it's nationwide, it's still based on your resident state. So I hope that helps clarify what a supplement plan is. Medicare Advantage. Now, Medicare Advantage is also known as Plan C. So you'll hear that being called Plan C as in cat. And with a Medicare Advantage plan, it's an insurance company that is managing your Part A, your Part B, and oftentimes they include your Part D, which is your prescription coverage. And so it'll include all of those, and you would have your, ABC insurance card, and that's what you show when you go to the doctor. They do offer HMOs and they offer PPOs. And with Advantage plans, oftentimes the premium can be as low as $0 extra per month, or they have a small premium, but usually the premium is much lower than a supplement plan premium. So with an Advantage plan, it's almost like it's an insurance company taking over managing your insurance, your Medicare insurance, and it's managed care. So with that, you're going to have networks. You're going to be limited to the network. You would have to, unless it's a PPO, you would have to select a primary care physician, and then you would have to make sure you're getting your referrals, and the referrals need to be in the network with an exception of, extenuating circumstance. If you happen to be in an area where that there is no specialist in your network, they are oftentimes able to refer out of the network for that. But Advantage plans are managed care, and they're going to be really focused on preventative treatment. So they're going to want to make sure that you're getting all of your approved tests, like a colonoscopy, your cancer screenings. They want to make sure that you're getting an annual physical. So with an Advantage plan, it's very much like the insurance that we have when we're employed. Typically, I know for me, working in corporate world, I always had an HMO. I think I had a PPO once, but I pretty much always have an HMO. So you have a primary care doctor. If you need to see a specialist, then you get referred to that specialist. When it comes to an Advantage plan, like I said, there are lower premiums, and you are limited to their network. So when it comes to traveling, that makes it a little bit more complicated. Typically, they will cover emergency. Emergency is always covered wherever you are within the United States. And emergency is covered. But for anything that's not an emergency, that has to be something that goes through your primary care doctor and through your network. Now, with a PPO, you are still in a network, but you have a broader network. So with a PPO, typically they're going to charge a higher premium, and they're giving you access to other specialists and physicians. So with a PPO, as long as that doctor will accept your PPO, you can go to that doctor. Just know you will likely pay a higher copay if it's out of the network. So PPO is Preferred Provider Organization. And that is sometimes an option for people who want more flexibility. However, they don't want to pay the monthly premium of a supplement plan. So the other thing about Advantage plans, they do oftentimes come with extra benefits. So they will sometimes be lumped in with things like some dental care or vision care, hearing. They do oftentimes offer transportation to your medical appointments. Advantage plans are really focused on preventative care. They want to keep you healthy and do what they can to make sure you don't need extensive health care. They're really trying to make sure they're available. They don't want you to have to miss your appointments. And so they do have things in place to help you with that. So when it comes to choosing the right plan, this is where having a broker can really help you, because as a broker, we do not, as an insurance broker, we do not work for one insurance company. We are contracted with multiple different companies. And so we can provide you with different options so that you're not just being told about one company only or one type of plan only. You can see what your choices are, what your options are, and then make a decision from there. So I would suggest reaching out to a broker if you know one, or if you don't, you can always reach out to me. And if you, or if you prefer, you can also ask your doctor. Oftentimes they work with brokers, and so they could have a trusted source for you to help you walk through the process and help find you a plan that is a good fit. So I do want to go over enrollment periods, because they do differ when it comes to Advantage plans and supplement plans. So with an Advantage plan, well, with any plan, there's your initial enrollment period. So that is 3 months before your birthday, the month of your birthday, and 3 months after your birthday, you have that 7-month window. That only happens once. And then every year, now this is for Advantage plans and for Part D as in dog, so your prescription plans. So if you have an Advantage plan, or if you have a separate Part D plan during the annual enrollment period, which is October 15th through December 7th every year, that's when you can make changes to those plans that will be effective January 1st. So that is for Advantage and Part D. That's not for supplement plans. We'll talk about when you can enroll in those in a few minutes. There's also open enrollment. So open enrollment is specifically for Advantage plans. So that is from January 1st to March 31st. And the open enrollment period is where if you didn't make a change during annual enrollment period, you have an opportunity to do so one time. Or if you made a change and you regret what you did, you have the opportunity to make another change one time in open enrollment, January 1st through March 31st. Other than that, pretty much you're in a lock-in period from April through December. But there are special enrollment periods. So if you have some kind of life event or if something happened that you weren't able to enroll in a plan during the annual enrollment period or open enrollment period, you may have an option. So if you need to change and you don't know if there's an option for you, always reach out to a broker. When it comes to Medicare supplement enrollment period, with a supplement, you have a 6-month window from when you turn 65 or when your Part B starts. So if you are working past 65 and you postponed your Part B, as in boy, then your 6-month window starts when your Part B starts. And this is important because during this 6-month window, there's no medical underwriting. And you can choose from any Medicare supplement plan. It doesn't matter which level you can choose from. Now, I'm saying this because when it comes to supplement plans, if you're outside of this window, there could be, and typically is, medical underwriting, meaning you have to be pretty healthy for them to consider allowing you to have their supplement plan. And so medical underwriting is where they will look into your medical history and see if you have certain illnesses. It's kind of like life insurance. Also, the enrollment process is going to go through a questionnaire to see what kind of health you're in. And so the open enrollment period for a supplement plan, that window, there's no underwriting. It doesn't matter how healthy you are or are not. You can get a supplement plan. It's very important to know that during that first 6 months, you can get into a supplement plan with no questions asked. And just as a reminder, as a broker, I'm here at no cost to you. And so you can always reach out if you'd like to, or if you scan the QR code, you can make an appointment with me. And if you like this video, please like and subscribe. Or if you'd like to see other content, feel free to leave that in the comments as well. So until the next video, I hope you have a great day.